The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hello everyone. Today on Aging Horizons we've got a real special guest. It's John Tabb, and he's one of the suicide prevention program coordinators for DPHHS. Veteran suicide rates are disturbing, distressing, and we need to find a way to fight back. We have a lot of great information for you today, so stay tuned.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Hi everyone, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and as I said in the open, we're going to talk about suicide prevention, specifically for veterans today. And with us is John Tabb. John, welcome.
Oh, thank you very much.
And you are a suicide prevention program manager for DPHHS, but you're also a retired lieutenant colonel.
That's correct.
And it's just wonderful to meet you. Thanks so much for being here.
Yeah.
Let's start out by talking a little bit about why this is such an issue, because I think anybody who has lived in the world understands and has heard that there's a really high percentage of suicides among veterans.
Absolutely.
Can you talk a little bit about that?
Sure. Well, there are a few reasons that sort of come together to make veterans a particularly at-risk population. One of those is that they're experienced to a lot of significant trauma. Whether they are combat veterans or not, military service takes a large toll on people, on families, on lives. That's one piece of it. Another is that a lot of veterans, especially aging veterans, experience chronic pain. That's as somebody who goes to the VA and receives services there, I can say that that's a part of my life in managing that. Yeah. But we know that chronic pain is a significant precursor to suicide risk. So that puts it there also. And then the other piece of it is social isolation. Yeah. In a place like Montana, which is, we all love to be here, but the very same things that can make it wonderful can put a person at risk, because if you live far away from services, you can be easily isolated. Yeah. And so when that comes together with other things like access to lethal means, firearms and things of that nature, it puts a person in particularly unique risk, and veterans especially.
Yeah, and what does it look like nationally versus Montana?
Yeah, well, in Montana we have a really high percentage of veterans living here.
Yeah, we do?
Yeah, so our rate is going to be higher than the rest of the country, or most of the rest of the country.
And skewed to some extent because of that.
Absolutely, yeah. But with veterans overall are a more vulnerable population nationwide.
So what are we doing, especially at the federal level? What are we doing to help with that?
Right. Well, the VA and SAMHSA have teamed up to start an initiative that started way back in 2018 called the Governor's Challenge. So they got together with states and their governors, and in many cases the TAG, the general who runs the National Guard, to develop a program of efforts to target the risk factors and build protective factors around veterans. So Montana's been part of the Governor's Challenge since 2018, and we have 2 cities in Montana, Helena and Billings, which were part of that program as mayor's challenges. So it's gone all the way down to the city level in those cases. And really what it's focused on is, first of all, identifying veterans in the community.
Sure.
Because a lot of times they go unidentified, not connected with services, they don't know what's out there, right? And the second piece of that is, once we've identified them, screening them for mental illness and for risk for suicide. So making sure that when they are seen by a primary care provider especially, that they are screened for it, they're given questionnaires in order to determine what level of risk they're at. And once that risk is established, getting them connected with care.
Yeah, because I think you're right. In Montana, we do have much more access to lethal means than maybe another state might, and I think that you see veterans. I see veterans as some very hurt people sometimes. And I appreciate that. I appreciate what you said about not all trauma comes from the battlefield, because there's a lot of trauma that they go through. And one of the things I think about, one of the things that my husband suffers from is tinnitus, and it was the pounding. He was on the flight deck, and it was the pounding and pounding. And I think all the time, all that noise must have been so traumatic.
Absolutely. Yeah.
And you just have to hope that, do you feel like you're being successful in finding the veterans and going to where they are?
Increasingly so.
Good.
We know that only about 40% of veterans use the VA, access to VA services. The rest of them are out there in the regular primary care community, and often they don't get asked the right questions. And so we're working on that. So a big part of this program will be to teach providers how to ask the question, thanking them for their service, understanding some of the unique culture that comes with military service, so they feel welcomed and included and more likely to open up and ask for help.
Exactly, and I think that we have all these forms that are standardized in our lives, and the 2 things that I want to see are, do you have a TBI, and are you a veteran? On every single one of those sorts of forms.
Absolutely.
Because those are both things that can be very well hidden, but very painful at the same time.
Yeah, absolutely. And the culture in the military often discourages seeking help and ask for help, and especially so with older generations. So the older veterans, Vietnam era and so forth, that are most likely to be dealing with chronic pain, most likely had things like TBI go untreated. Now they're in a position where they're at extreme high risk, and so identifying them and asking them those questions, even if it's years after it happened, is important.
Well, and I'll tell you, my husband, as I said, was on the flight deck, and he never ever went and reported any kind of issue, because he told me he'd end up in the kitchen.
Yeah, you'd lose your status.
And
absolutely.
That wasn't what he signed up for. So
absolutely.
Well, thanks for that information, John. We have a whole lot more to talk about, folks. We want to make sure that we're looking for veterans that need our help, and getting that stigma to go away, getting them to know that they're welcome home and that we really thank them for their service. Come on back.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Hi everyone, welcome back to Aging Horizons. We're here with John Tabb talking about suicide prevention for veterans. John, good to see you. So you were talking in the last segment about an initiative, a Governor's Challenge, that you're working with. Would you want to tell us a little bit about that and just how that's going?
Sure. Well, as I said before, the first part of it is identifying and screening veterans that are at risk and putting them in contact with services. The second piece of it is developing a network of peers, so other veterans in the community who've shared their experience, who understand their culture, who can bring together networks of veterans, especially in rural areas, because we know that the biggest protective factor for suicide is connection, is having people around you that you can share yourself with. And really, for veterans, it's very hard to become vulnerable with anyone who hasn't experienced what you've experienced or that understands you. And so these peer networks are really key. They're every bit as important as primary care providers are to them. So second part of the Governor's Challenge is finding out who out there in the community is willing to become one of these peers, getting them certified to be either a peer coach, which is just really kind of a friend that brings a group together, or a certified peer specialist who actually gets training and is connected to the VA and can help veterans get services more readily. So that's a big piece of it. And then the final priority is on safe storage of lethal means. As you mentioned, we have a gun culture in Montana, and so most veterans do have a firearm. And so we know that that puts them at extreme high risk when those other conditions come together. So just having a place that they can take their weapon when they're in crisis and have that person watch the weapon while they get through it and get the help that they need. So what we're, along with trying to establish a network of peers, we're trying to establish a network of places that will hold firearms when people are going through crisis. And we like those two things, the peers and the storage facilities, to work together so that veterans can go a short distance to do that.
Right. You know, and you were talking about how a lot of this that we're talking about today with suicide prevention goes back to World War II. And, you know, I recall very clearly my dad never wanted to talk about it.
Right, mine too.
And was absolutely moving forward. And I can see where, you know, I think my dad was fortunate that this didn't happen to him, but I've seen other veterans who bottle it and then years into maybe as they're aging, they simply can't hold it in any longer.
Absolutely, yeah.
And they need those peer mentors that you were talking about. Like who would be a peer mentor? Another veteran?
Yeah,
Okay.
potentially another veteran. And I mean, I got into this field of mental health because I was a veteran and knew that there was the power of the connection that we have right off the bat.
Right.
And so, yeah, we're looking for other veterans. They don't have to have any kind of training in mental health treatment. They just have to have the desire to help their brother or sister veteran.
Right.
And so, yeah, we're engaging with the American Legion and the VFW and a lot of other sources to try to find those folks and give them the tools to be able to do that.
Because I think those are even places where it's harder for the older veterans to get to. I know, again, in my own situation, VVA and DAV and meetings like that were very important to my husband when he was younger, and as he started to age and was less able to get around, he can no longer get to those.
Right.
And I think he misses them greatly because he really did like the companionship.
Absolutely.
That comes with those sorts of things.
Yeah.
And I think that so and what about there's one question I do have about maybe more, let's come up to today in real time. Are service people, when they separate, which is when they leave the service, are they asked to do a baseline of health and wellness and emotional health?
Yeah.
So how does that go?
Yeah, fortunately nowadays, different from the past that we talked about,
Right.
there is a process for screening on their exit from military service. So they go through a process along with their physical to determine where they're at, their baseline, as you say.
Yeah.
And then they're encouraged to enter the VA system, but they're not required,
Well, no,
obviously.
yeah, right.
So we really want them to do that, but some of them are out there and they want nothing further to do with the military, which is totally their choice. Their right.
Yeah, absolutely. And I think I know a lot of veterans, Vietnam veterans especially, that maybe feel that way, and my goal has always been to let them know they're welcome wherever, and maybe someday they'll change their mind,
Right.
and they'll want to try it out, and things happen differently in our heads as we age. That's for
sure.
darn sure.
Yeah.
And how long has this governor's initiative been going on?
Since 2018.
2018.
Yeah, we had a little bit of a lull during COVID,
Sure.
and so we're really kind of building back up, and we've
Sure.
added the safe storage of lethal means to the program. That wasn't part of the original, so we've expanded it out to really looking at the factors that keep veterans safe out in the community to make it most effective.
Okay, so I have some more questions about that when we come back.
Yeah.
And folks, again, we're talking about an absolutely stigmatized situation where these men and women often feel they can't speak out because they're supposed to be tough and resolute and the heroes and the ones that take care of us. We need to take care of them. We need to reach out. If there's a veteran in your life that you think might be suffering, or if there's just a veteran in your life, connect and ask them, do they need anything? Is there any way that you can support that person? Because they need us to welcome them home. They need to know that we absolutely appreciate their sacrifice. Come on back, we have a whole lot more.
Respite care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, respite care provider, on the unexpected benefits of helping people in need.
Being a respite care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, but my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Hi everyone, welcome back to Aging Horizons. We're here with John Tabb talking about suicide prevention for veterans. John, you know, we've been talking about the initiative that you've been working on, and you know, as so many other things did, you sort of saw some slower movement probably during COVID and the pandemic. But then you mentioned that you're sort of gearing up now. So what does that mean? What does that look like?
Yeah. So during COVID, it was difficult to reach out and connect with peers that were in the field and find more peers. Everybody was kind of hunkered down. So now what we want to do is bring together all the people in the state who are involved in supporting veterans. Nonprofits like Healing Waters, all these outside organizations, dog tag buddies that have emotional support
They
animals.
were here a few weeks ago.
Very good, yeah. So we'd like to bring them together in a symposium so they can learn who's who, you know, and find out who else is doing similar things and then coordinate their efforts.
What a great idea.
Yeah.
Sort of like, you know, they haven't done one in quite some time. Is it called a stand down? Where they put everything over at the park with tents and
Yeah, I've heard of that.
Yeah. And I don't know if that's the right military term or not, but we haven't had one in a long time. And what you're talking about is sort of like that, just bringing bunches of what could be resources, ideas, contacts together, and hope that people can find ways that they might be able to collaborate.
Yeah, and the great thing too is we're not the only show in town.
Yeah.
There are other initiatives like Joining Community Forces here in Helena that bring together people who are concerned with veteran suicide. So we really want to coordinate all that and be part of it rather than take it over.
Yeah.
Or replace anything.
Yeah. Well, you know, I mean, I think the thing of what I like about it is that, and you've mentioned it several times during our show today, veterans are a specific kind of person. And if you're not a veteran, you know, one time I had another veteran tell me to never tell my husband that I was on his side because that was too triggering for him. I wouldn't have known that,
right?
But I know it now.
Right.
And I do the best I can to be that veteran wife, but I'll never understand everything you went through, nor will I ever understand yourself or any of the other folks who are veterans in our lives. And maybe that's okay, but only if we're reaching out.
Absolutely. Connection is the key.
And making sure that, and let's mention 988.
So I also work on the 988 program. So back in July, we stood the 988 program, which is a 3-digit number that replaces the old 10-digit lifeline that was hard to remember for folks. 988 is intended to be like 911, but for mental health crisis. So if you dial that now, you'll be given prompts. Prompt number 2 is the veteran Veterans Crisis Line. So you can dial that and be connected with a veteran who can speak to you.
Yeah. And again, so important that we have veterans helping veterans.
Absolutely.
And making sure that we support in whatever way we can. I love what you said about thanking folks for their service, that it should just be, it should be a no-brainer.
Right.
And, you know, and I find that people feel very valued.
Yes.
When you do that. And so I think it's a real easy way for all of us to celebrate the veterans in our lives. So we just got about 3 minutes. John, what should we say about preventing suicide for veterans?
Because Montana is such a spread out place, I encourage everybody to look around them in their community and find those veterans that might be suffering alone, knowing that isolation is such a risk factor. And then participating, being part of your community, reaching out to organizations that may be supporting veterans, encouraging folks to be peers, to step forward and to help bring together veterans and create little great gatherings that can help one another in their communities.
Right, and you don't have to be another veteran to be a friend.
Right.
You can be a friend.
Absolutely.
As long as you don't sort of, oh yes, I get what you mean.
Right.
Because that isn't...
Yeah, make the effort to learn a little bit about it,
sure.
learn some of the cultural unique things to veterans.
Sure. And anything else coming up that we should know about that's, I mean, well, one day, you know, actually, no, let me back up. One thing that I wanted to ask you about was during pandemic, was it really pretty, did the numbers go up?
Well, actually what we've seen is kind of a hunkering down. There wasn't, during the pandemic, it wasn't too bad. After the pandemic, we're actually seeing some of the fallout from the isolation that people
Isn't that
experienced.
interesting?
Yeah.
I think because we probably feel safe enough to have some fallout at that point, and we're, you know, we're no longer terrified that we're going to get a terrible disease.
Absolutely.
And, you know, and I guess I just want to say thank you so much for all your service. And this is a huge problem. We don't want this to continue. Absolutely. We want our veterans to know how cherished they are and how valued they are. And I just talked to one of our field staff whose baby went off to Missouri to boot camp yesterday.
Fort Leonard Wood.
Yep, there you go. And she said to me, we're trying to replace our tears with just pride.
Absolutely.
Pride in this young man. And I think that veterans are some of the best people on earth. So I'm so glad that you could be with us, John, and I hope that your initiative keeps going well. And I think you have a wonderful attitude about helping these folks through whatever it is.
Well, thank you, and thank you for having me.
Absolutely. And folks, remember, if you have a veteran in your life, reach out. Even if you don't, find one and reach out. They need us. They deserve our support. For Aging Horizons, I'm Kimmy Everman.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.